Okay, so I just finished my consultation with Beatrice. We talked in a little bit of detail about, her sets of implants. She's had 2 sets of implants in place. She's actually had 1 set of saline, the second set silicone. They were both placed underneath the muscle. She does not have symptoms that are consistent with breast implant illness. Her concerns are, one, the longevity of the implants and the risk of rupture goes up, and she's reaching that point. 2, she's having a lot of pain, especially on her left breast and then right shoulder, which she thinks is attributed by the implants. And then 3, she is uncomfortable with the size of them. She feels like they're too big and it makes her uncomfortable in a general sense. And then lastly, from all the knowledge that she has and the patients she's been treating with breast implant illness, she just doesn't want to run the risk of developing any of those symptoms in the future. So she brought up those 4 main points, and I think those are excellent points that make her a great candidate for explant surgery. So after examining her, she is contracted on the left side. The right side is not so contracted. The breast tissues have dropped differently on each side, with the left side being dropped lower, contracted higher. The right side is softer, but it's dropped a little bit more, so there's some asymmetry. So what I've recommended for her is to do a explant with a total en-bloc capsulectomy. That's the goal. And then we'll start with the lollipop lift. So that involves making an incision around the nipple areola and going up and down, just like a lollipop looks. And then I'll determine on table whether she needs a little bit of tissue taken down from the bottom that would make it incorporated into an anchor lift. And I think we're gonna achieve some of the goals, with this way the implant's contracted on the left. The things most commonly we've been seeing is that it's stuck onto either the muscle or even the rib cage, and patients are complaining of pain, especially underneath the nipple areola, with shooting and stabbing pain. So once we eliminate all that contracted scarred tissue, I think she'll find a lot of relief from that. And on the right side, what I do notice is that as the implant drops and the implant and the capsule pull on the tissue or the fascia over here, she could be having some strain in this area related to that pull. So I'm optimistic that she'll feel better from those symptoms. But also the main goal and one of the big things is she just doesn't feel comfortable with the size of the implants. She has great breast tissue, so I think taking them out and doing a nice lift is going to accomplish all our goals. Of note, when we do these consultations, we have to make sure each patient it's medically safe to do these surgeries. So she did recently suffer from a serious bout of diverticulitis, for which she was hospitalized numerous times, and also had a lower back sprain and a slipped disc. So we've been kind of watching that over the last few months, and she's recovered quite well from it. We have a few more tests to make sure that she's completely cleared for surgery. And once we get the thumbs up from all the medical doctors, the gastroenterologist, then we're going to move forward with her explant surgery. Thank you.